Today I'm going to talk about the Medicaid program and try to inform people about the different guidelines for it. In today's society, there are several people that are not covered by insurance, have partial coverage by insurance, or hold the Medicaid coverage and just do not understand it. I'm trying to get rid of the fears for each of you to ease your mind at basically where to go to ask questions, who to go to ask questions, what questions do you ask, and what exactly the Medicaid program does cover. In addition, when you do call your provider or your physician, what questions do you ask them? Try to get rid of some of the fears in those areas. Maybe because in different circumstances, you could unfortunately fall into some loopholes under the Medicaid program. Once you have first discovered as to whether you want to apply for Medicaid, where do you go to ask? Well, start with your physician's office. When you go in for an office visit, ask them if they have a patient benefit representative that will assist you with the Medicaid application. Several doctor's offices do have these capabilities. If you're going to a hospital, they do have additional resources there. They have areas of patient advocacy groups that also help you. Or just plain go to the Medicaid office. In the Medicaid office, they can set you up with the application. A lot of times do the application for you. Now that you've figured out who to go to for the questions, what questions do you have? Are you actually eligible for the Medicaid program? Well, let's start with the Medicaid website, which I put a copy of the initial New York State website on my presentation form here. This is a question and answer area which does help you out. For the Medicaid program, there are different criteria whether you can be eligible for Medicaid. First, start with what do you bring to the office if you do go to the actual Medicaid office to apply for the program. Make sure you bring your birth certificate, your social security card. Bring your tax information. That's key because it is based on income. Bring your driver's license. If you do not have any forms of these types of IDs, a lot of times this Medicaid website will tell you what other forms of ID they do accept. Now, once you've determined that you have the correct information to bring with you, whether you are income eligible. Based on a family of 4, it says here on the chart, if you make $15,512 yearly, you are eligible for the Medicaid program. Now, if it comes out to be that you unfortunately reach above those criteria, what you can do, there are additional programs that you can ask about. You have Child Health Plus, you have Family Health Plus that are additional programs. Child Health Plus, for instance, is an application that you can do based on an income, but it's pretty high up there. So don't be worried just because you're not eligible for Medicaid. That is completely pointless of all your hard work you've done to try to do your research. In addition to the Medicaid website, you have the government resource websites, you have CMS, you have the Medicaid, and you have the Medicaid manuals. On these types of manuals, it tells you exactly what is covered. You're covered for your vision, your dental, you're covered for the doctor's office visits, physical therapy, and believe it or not, smoking cessation programs, which several physicians do push nowadays, especially if you are smoking. So those are definitely key points to keep in mind as when you're going to the offices as to what may or may not be covered. But again, there are several different websites available for you at your fingertips. If you cannot actually get into a computer to do more research, definitely, just pick up the phone and call. Finally, in my final point, I want you to be aware of the definite loopholes that you could face during the Medicaid program. When you want to go to the office or you want to get a new physician, make sure when you first call, you ask them whether they participate with the program. Because a lot of physicians, unfortunately, nowadays don't participate with Medicaid, or they're opting to not go into the program for the next year. This is because, unfortunately, Medicaid does not reimburse too good. Your visit could be $100, and the physician may get paid only $30. So more and more physicians will, unfortunately, go into specialty care, versus primary care. So definitely ask those questions. In addition, make sure you're asking the physicians if it is covered, is there any out-of-pocket expense? You could have no copayment or you could have a very large copayment. These are all key points that you want to make sure you inquire about before going into it, because if you unfortunately you do have something that is going to require several visits, you don't want to be surprised with a high bill. Finally, hopefully I've been able to rest assure you and put your mind a little at ease, or at least provide you in areas that you can go to get some answers for yourself. I gave you examples like a physician's office or the Medicaid website. I gave you what websites to go to that will help you out with your questions, how to apply, where to apply, and finally what key points to ask so you aren't surprised by no loopholes. And if you go out of here with anything, hopefully you go out of here with at least one fact that will help you in your future endures for the Medicaid program.